everyone, this is Hannah with your daily Rocket Miner COVID-19 update. Today, looking at the CDC numbers for coronavirus cases, they are reporting a total of 186,101 cases with 3,603 deaths. Wyoming today is up to a total of 137 cases, and now only 8 out of our 23 counties are not reporting any confirmed coronavirus cases. Remember that this total number doesn't count the people who have recovered, which was I think around 26 last night. And the recovered people are still included in the total amount just to get an overview of all of the cases that we have had and where that number's at. But keep that in mind when you hear the numbers. Lots of people are recovering, which is really great. We're very thankful for that. Today, Teton County announced that they have issued a shelter-in-place order for the county itself. So even though we're still not under one for the entire state, and the governor is still hoping to avoid that, some counties are choosing to do that themselves. And Teton does have a slightly higher number than some of the other counties as far as the confirmed cases go. Today, the Sweetwater County COVID-19 Emergency Operations Center hosted a virtual press conference, and Dr. Jean Station, the Sweetwater County Health Officer, spoke during that conference and gave a few more updates on where we're at as a county. She explained again just the importance of realizing how fast and easily this virus can spread and how quickly the numbers can just go up exponentially because of how it's spreading. So again, just the importance of staying home, washing your hands, doing everything you can, following these orders and guidelines to be safe and stop the spread. She also gave some updates on our local testing availability and how that's working. She said that more testing is available now. That's expanded, even though it's still limited. There are more tests now. And she also explained how the testing process has changed a little bit. Right at the beginning of all of this, they were still trying to test for other things before they tested for COVID-19, because the reasoning was, well, if we can rule out the flu or any of these other potential illnesses, then we'll rule those out first before we test for COVID-19. Unfortunately, continuing to do that would take a very long time and cost a lot more money. So the testing rules have changed now to where they're able to just more directly and quickly test for COVID-19. So that's good. It saves money, saves time, and helps us get those results quicker. She also said that the average time for test results to return is about 48 hours, but that also depends on the test and the priority of that test and who's being tested. Today, Memorial Hospital also had a virtual meeting that was a Board of Trustees meeting. During that meeting, Kim White, the incident commander at the hospital, told the board that since the hospital is not doing elective surgeries right now, the same-day surgery area is actually ready to be used as a secondary emergency room if that becomes a need. So that's an option. She also said that the hospital received 800 masks from the national stockpile, and they're hoping that they'll get more soon. And they're working to limit and conserve on the number of PPE and the equipment that they have so that that's used wisely. Irene Richardson, the Chief Executive Officer at the hospital, said that the swabbing stations that the hospital has set up are working really well, and they've been doing drills at the hospital with mock patients. They've been doing all these things to help them keep preparing to be able to help people and serve people even better. She said everyone who goes into the hospital right now, including the staff, has their temperature checked first, so they're taking as many precautions as they can. And she said that the hospital is just as prepared as they can be, and she wants the community to know that the hospital is there for them. They're helping us in every way they can through this time, and we're really thankful for all the hard work that they're doing. The EOC, in their status report that they gave today, clarified a few things that have been in discussion. They said that while the 2 confirmed positive cases that we have in Sweetwater County are probably linked, like they said, to Natrona County and the cases there. The origin of transmission isn't totally certain yet, so there's a likelihood it's linked to Natrona County, but we don't know that for sure. They also updated again, the first confirmed patient from Green River is fully recovered. He's doing well, but continuing to self-isolate just to be safe. And the second confirmed positive patient in Green River is still in quarantine. He's in good condition. He has mild symptoms, so he's doing all right. And their report also estimated that about 50 people in total throughout the county who were symptomatic are in quarantine pending official test results, or they think that they may have been in contact with it, so they're voluntarily self-isolating to be careful. The EOC wanted to clarify that 50 is not a specific number. They said it's an estimate we made in consultation with our county public health director based on contact trace information obtained from our confirmed positive patient number 2's care provider. Only 3 of patient number 2's close contacts currently meet state testing criteria, but the rest who may have been in contact with him are self-isolating at the direction of their employers' care providers to satisfy their employers' requirements to mitigate possible exposure and spread amongst employees and businesses. So they're all self-isolating, quarantine just to be safe. Both Castle Rock Medical Center and Memorial Hospital are collecting the swabbing and sending that off for the testing. So Castle Rock Medical Center reported that they've collected a total of 26 COVID-19 tests. They have had 15 returned negative, and there are 11 that are still pending results. Memorial Hospital reported that they've collected 261 COVID-19 tests. The 2 have returned positive, which are the 2 confirmed cases we know of. 148 have returned negative, 90 have been rejected, and 27 rejected for follow-up testing, according to the EOC. So we have these tests. The hospitals and all of our centers are doing as much as they can to keep testing people, to keep checking on the status of the virus here in Sweetwater County, and just still encouraging people to do as much as you can to stay safe, stop the spread yourself, and limit contact with other people. Just keep taking these precautions to be careful. To end, I just wanted to end on a positive note, and I wanted to share this little thought from one of my favorite books. It's called Good Morning, Good Night, Little Pep Talks for Me and You. It's by Lin-Manuel Miranda, and it's full of just every page has a good morning message and a good night message that are usually related to each other. And just, if you can get your hands on this book, just order it online or whatever, or go check Lin-Manuel Miranda's Twitter and just scroll for a really long time. He posted these on his Twitter and then he made it into a book. But it's just encouraging and positive and uplifting, so I just wanted to share one of my favorite segments from that book. Good morning. Untie just one of the knots in your stomach. Cross one thing off your list. Call one loved one and surprise them with some kindness. Look at all the room you made for something new, kid. Good night. There are still knots in your stomach. Mine too. A good night's rest won't undo them completely, but it loosens their grip and softens the strands. Close your eyes and make room for something new, kid. Thanks for listening. Keep checking for more updates. Have a good night.